Striking junior doctors are demanding that the health minister step in and sort out their deep employment row. Thousands of junior doctors walked off wards today in a protracted dispute with the district health boards about who should control changes to rosters and other workplace practices. The doctors walked out of every public hospital except in Canterbury, which was exempted because of the mosque shootings. With more, here's our health correspondent Courtney Brown.
About 30 junior doctors in Dunedin picketed outside the office of the Health Minister David Clark today, demanding he get involved in the row with their bosses. A Resident Doctors Association delegate, James Anderson, says their message is clear: the Minister needs to listen to them, and soon.
We've been bargaining with the district health boards for the last 12 months, trying to get to a point where we can settle our agreement, our MECA, and we're not getting to that point. The DHBs are insistent on taking away protections in our contract and taking away our rights to come to agreement about how we work, where we work and when we work.
Dr Anderson added the Health Minister has been careful to stay out of the employment dispute, but that's no longer acceptable.
So he's been contacted in the past and he's said up until now that this is none of his business, and so what we're trying to do now is tell him today this is his business and that he needs to control his DHBs.
He was backed by the union president Courtney Brown, who says doctors are striking for a fifth time to protect current provisions of their now expired employment agreement. She says strikes will continue until that's achieved, adding action is needed to ensure upcoming facilitation through the Employment Relations Authority ends the dispute.
Those full strikes have gotten us to a point now where we are going to facilitation, and the point of this fifth strike is to try and ensure that we get a settlement at the end of that process.
Capital and Coast DHB wouldn't allow Checkpoint to go into Wellington Regional Hospital to see how it was managing today. But its Chief Medical Officer, John Tate, reported the day has gone well, with more junior doctors turning up to work than expected, especially relatively senior registrars. He was unable to give exact figures, but says union members turned up, along with members of the Stones Union and doctors not in either union.
We weren't expecting anybody from oncology, and we had at least 2 or 3. Medical registrars, we normally run on 19, and with non-members of the RDA, we've got 10 of those working, and most of the surgical and women's health registrars are working as well.
Wellington Hospital rescheduled all non-urgent surgery apart from cancer surgery this week, along with most clinics, but it may be able to reconsider that if more doctors than expected continue to turn up for work. Dr Tate adds his main concern, however, is whether staff, including senior doctors or SMOs who are filling in for others, can keep it up for the 5 days.
If you've been an SMO and then you're having to work as a registrar, it's not like for like. So there is this stress of doing things that you're slightly uncomfortable doing, but knowing that you'll do them well. Now, that's always been sustainable for 2 days, 3 days. Whether it's sustainable for 5 days is something when you ask me what worries me, that's what worries me.
He adds it won't affect patient safety, but it will make for a highly stressed workforce. Catching up on postponed surgeries would also take considerable time and add to stress levels. The DHB's National Contingency Planner, Anne Aitchison, is well aware of that.
That varies from District Health Board to District Health Board, but it will take months. Each DHB does things differently. There will be extra surgical sessions run, there will be extra clinics run in order to assist with the recovery.
In the meantime, hospitals around the country have their sights set on 8 o'clock on Saturday morning, when this strike is due to end. Mo te hotaka o te ahi, ko Courtney Brown, tēnei.